Hey everyone, welcome to the main event. Today is Thursday, May 18th, 2023. Glad you guys have stuck around. Thank you for your patience. Had a little bit of technical difficulty with the timing of today's show, but you know what? That's how things go. While I'm talking into this microphone, I want you guys chime in the chat room. Make sure that you can hear me okay. There's a little bit of a delay before you actually hear me asking that. So while you're about to hear that, I'm going to go ahead and tell you guys who I am and why I am behind this microphone. My name is Joe Tillman. I am a 20-year veteran of the hair transplant industry, working at a very high level. Now, what does that mean? I've said that many times before. What does it mean when I say that I work at a very high level, or that I worked in clinics at a very high level? It means that I worked for clinics that were recognized world leaders, which means that the education I got when I first was a patient, getting my consultation, and then from my doctor, Dr. Jerry Wong, and then subsequently working in this clinic for 11 years, I learned not just a lot of stuff, but I learned very detailed, highly refined details about surgical hair restoration. And I feel very fortunate about that because it has allowed me to quantify my standards, if that makes sense. Because I from very early on in my career, I was very concerned about naturalness, and I was very concerned about how clinics conduct themselves in the clinic and also outside the clinic as far as their marketing and their presentation to patients. And I've carried that over into what I do today, which is, you could call it almost like an independent hair restoration educator, influencer on YouTube and Instagram, what have you, where I'm applying those standards that I've created to clinics I work with, not just in admitting them as members of my organization, hairtransplantmentor.com, but also in how I can guide them behind the scenes to be better. Because I see areas of improvement, and I come in almost like a business consultant, a clinical business consultant, to help them refine their techniques as far as their patient outreach and how they educate patients, and even some of their internal protocols. Because I've been exposed to so much, not just the clinics I worked for, but over the past 8 years, clinics I work with. And I feel fortunate about that. It's really fun. And I've gotten to meet a lot of great people. And among those great people is Dr. Bevin Bhoyrul from Melbourne, Australia. And if you've not heard of Dr. Bevin Bhoyrul, he's quite published in the world of hair loss, and he does a lot of research into dermatological ailments that do affect hair growth, hair loss, things of that such. I'll go ahead and read a little bit about Dr. Bevin Bhoyrul so you have an idea. He graduated from University of Newcastle in the United Kingdom in 2005, initially trained in general practice, which gave him a broad outlook on medicine, and then he subsequently completed his specialist dermatology training in the UK before moving to Australia to undertake medical and surgical hair fellowships at Sinclair Dermatology, which is kind of famous in the hair loss world when it comes to the subject matter we're going to be talking about today. Among his published works, I think these first three were just published this year, and he can correct me if I'm wrong later on. Treatment of moderate to severe alopecia areata in pre-adolescent children with baricitinib. Am I saying that right? I never did learn how to pronounce that one. Switching between tofacitinib and baricitinib and alopecia areata, a review of clinical responses. Treatment of moderate to severe alopecia areata in adolescents with baricitinib, a retrospective of 29 patients. And then before that, there was effective treatment of refractory lichen planus. Was that pemphigoids? Sorry, I can't see. It's too small. With a Janus kinase 1/2 inhibitor. And before that, treatment of lichen planopilaris with baricitinib, a retrospective study. I find those last two kind of interesting because I had early exposure to lichen planopilaris on the surgical side and how it can affect the outcome post surgery. It's quite interesting. And then there's a study that he's co-author with Dr. Sergio Vano-Galvan, as well as Dr. Rodrigo Piramez and Angelo Hermosa Gilbert, and that was called The Safety of Low-Dose Oral Minoxidil for Hair Loss, a multi-center study of 1,404 patients. It sounds impressive, and I think it probably is. I'm going to pull up Dr. Bhoyrul. Doc, how you doing?
Very, very good, Joe. Thank you so much for inviting me. Thank you.
Welcome to the show. Certainly appreciate you taking time out of your early Friday morning. What time is it there? It's, 8:23 in the morning?
It's correct.
Yeah, Friday morning there in Melbourne. I really do appreciate you coming on board. I've been excited for you to join us today because there are questions that people have about oral minoxidil. That is the hot topic, and that's what we're going to be talking about today, and any other questions that people may have. But before we start taking phone calls, I'd like for you to maybe take a moment and give your impressions of oral minoxidil and how it fits into today's hair loss regimen for men and women that may have some form of androgenetic alopecia.
So for me, oral minoxidil has revolutionized the treatment of androgenetic alopecia as well as other hair loss conditions. Some of the results we see now, I know topical minoxidil has been around for decades, but in my opinion, and I think many people will share that, oral minoxidil is far better. Oral minoxidil sort of bypasses some of the problems that you have with topical minoxidil, and contrary to popular belief, it is quite well tolerated if it's dosed properly, and if it's given to the right person, which happens to be the majority of people actually, of all ages.
Now, when you say of all ages, expound on that. How young of a patient, or more specifically, I guess it would be prudent to ask, what's the youngest patient you've prescribed this for, and what's the outcome?
Well, they're not patients with androgenetic alopecia. There's a condition that affects very young girls. I don't know if you've come across it, called loose anagen hair syndrome, which affects young girls with blonde hair, typically, where they have massive hair shedding, and it can start from the age of 3. And we have even used, minoxidil, in a syrup form, in 3-year-old girls at a much lower dose, of course, and that's also published. It was well tolerated. It was given to a group of 8 girls. Only one of them developed sort of some hair on her legs, but otherwise it was well tolerated.
I think that I've heard about the side effects of excessive body hair growth in various degrees, and I think that it's safe to say people would happily shave or opt for some form of permanent hair removal elsewhere in their body if they can have the hair back on their head. I'm sure you've run across that issue, that conundrum where people say I'm fine with a little extra hair on my legs or my arms as long as I got hair on my head.
Oh, absolutely. I mean, sort of people tend to associate that side effect with women's reluctance to take minoxidil. However, this is I see men and women with androgenetic alopecia daily, and women will regularly tell me that yes, I might be getting a bit of hair on my face sometimes even, but I can manage that as long as I've got hair on my head, as you just said.
Well, and let me ask you something. So you mentioned very low dosages when you're talking about the application for the kids. When I first heard of oral minoxidil in relation to hair loss, it was many years ago. Actually, and you might know the company. I was talking to someone in Tasmania. I've mentioned this before on the show. Back in maybe around 2006. And he said that he was dealing with a company, it was a chain clinic in Australia, and it had like some sort of generic name like Maxim Hair Clinics or Advanced Hair Clinics, something very generic.
Yeah, that's the one. That rings a bell, Advanced.
I think it was Advanced, actually, where they would, and there was some sort of some sort of Japanese connection, I think, like maybe a Japanese dermatologist was involved. All this is just now coming back to me. I may be mistaken, but I think that I remember that, where they would apply two different treatments. One would be a tablet of Lonitin, 10 milligram, and the second would be their own concoction, their own witch's brew that they would also have you apply topically. And this guy, he'd been sending me pictures for months, showing me that he's a Norwood 6. I performed a complete consultation virtually on him back in the day, and he hopped on a plane and flew to Vancouver from Tasmania, not to see Dr. Wong or Dr. Hassan, to see me, because he wanted to show me the miraculous turnaround that he'd had with that combination. And I, knowing what we know now, I can't help but think it was strictly from the Lonitin. But the guy had what looked like a full head of hair. It was an amazing turnaround from a Norwood 6. Now, granted, from the photos, I don't know if there was a lot of miniaturized hairs I just couldn't see in the image, or the images. But make no mistake, the guy had, for all intents and purposes, aesthetically speaking, a full head of hair. Looking through it, you could see the lack of density compared to what would be considered a full head of hair, but cosmetically, aesthetically, it looked like a full head of hair. It was insane. I'd never seen anything like it before. That's my earliest reference to oral minoxidil for hair loss, and it was a full 10 milligram Lonitin. Now I know that what we're seeing with the consensus is 2.5 seems to be the go-to dosage. But when you're talking about significantly lower dosages, what were you referring to for these children?
So with these children, we based it on body weight actually, but it was doses even as low as 0.1 in the case of a 3-year-old girl.
Wow.
We would, and if it was tolerated, then we'd go up to. There are some kids, obviously, if they're. You have some teenagers who weigh 50, 60 kilograms, then we easily go up to half a milligram.
Right. Okay. That makes sense. But yeah, I like the idea of bringing it up from such a low dosage point. Wow, that's. I never realized you could, how do you even get such a small dosage to begin with? Is this a custom compound? Because I can't imagine the tablet being cut that small. But anyway, I digress.
No, well, it's actually in the form of a syrup for the kids. But.
Oh, yeah. Okay. Oh, syrup. Okay. Got it.
Yeah.
Got it. It makes sense. All right. So I think I saw a question in the chat room. Someone was Eminem in the chat room says, question for Dr. Bhoyrul, is oral minoxidil effective long-term if you take it 2 times or 3 times a week, or does it have to be in the bloodstream every day to work properly? For example, 5 milligram 3 times a week versus 2.5 daily. It's a good question. What do you think?
Look, I mean, all the studies look at minoxidil daily. Minoxidil has a short half-life, so and it's you swallow it. It's broken down by your liver, and it doesn't last very long, actually. That being said, I think 3 times a week is fine. I have a feeling that someone who takes the tablet daily will have better results than someone who takes it 3 times a week. Mm-hmm. But I think 3 times a week is fine. I'm wondering if there's any particular reason why he does it that way, or she does it that way.
Well, I'm not sure if he's if they actually take it like that. I think it's just a general question, but he can he or she can respond later if they feel like it. So I'll go ahead and open the phones. The lines are open, so you can call in and you can ask Dr. Bevin Bhoyrul directly any questions you have about oral minoxidil. He has taken his time on Friday morning to be with us from Melbourne, Australia. The number is 1-833-563-4247. The number is up on the screen right over there. Oh, got a call. Okay. Got a couple calls. See. All right, you are on the main event with Joe Tillman and Dr. Bevin Bhoyrul from Australia. What's your name and where are you calling from?
Hey, this is Jack from California.
Hello, Jeff from California. How are you?
I'm doing great.
Hi, Jeff.
This is a really special event because I was just talking about oral minoxidil today with someone.
Okay, real quick, Jeff, before you start, I need to see if you can hear Dr. Bevin Bhoyrul. Dr. Bhoyrul, can you say hello?
Hi, Jeff.
Okay.
Loud and clear, yeah.
Oh, thank God. It works. Okay. All right, Jeff, go ahead and ask your question.
Yeah, you're getting good, Joe, with this sound system and everything. So here's my question. I started oral minoxidil 2.5 mg about a month ago, twice daily. Earlier I was taking like once, but I thought because I've been on, the topical minoxidil for more than a decade, it might not be working. So I started doing it twice daily. Having said that, can you suggest going forward, how should I monitor the success of being on oral minoxidil, total 5 mg, 2.5 into 2, twice daily? And how should I make a decision of what dose I should be on? Like how much time does it take to see the results? And how should I monitor my dosing and results going forward?
Did you hear that, Doc?
I did. I'm not sure I understood the first part of the question, but how should you increase the dose? Look, generally, our approach is to increase the dose according to response and tolerability. So what I mean by that is, of course, lower doses. With higher doses, you will get better responses in terms of hair density, hair counts, and so on than you do with lower doses. So I would steadily increase the dose until you've got the result that you want. Now, we typically increase by about 1 milligram increments. So we'll do 1 milligram every month or 1 milligram every 3 months. But if you can't compound it, if you've got, I think in the US, you've got 2.5 milligram tablets. So you can increase by a quarter. You can increase by a quarter every month and watch out for the potential side effects of minoxidil, which are a drop in your blood pressure, which will manifest as a bit of dizziness or a rapid heart rate. Now, that being said, I don't know, Jeff, how old are you? Are you healthy? Are you healthy?
Yeah, good question. So I'm 30 years old, and I think I should have also mentioned I'm also on 1 milligram of finasteride for about a month now, and prior to that, I was on 0.5 every other day for close to 5 more months. So 6 months of finasteride use, started oral minoxidil. Considering I was on topical for more than a decade, and I suspected it had stopped working, that's why I started oral minoxidil.
Yeah, look, I mean, you're in your 30s, you're in good health. I would have no qualms at all. In fact, we actually sometimes use doses even greater than 5 milligrams. So if the 2.5 milligram dose is giving you your desired result in terms of your hair density and how satisfied you are with your hair, then I would stop there. I often make the analogy with patients with weight, if you're wondering whether you should diet or whether you should exercise more, well, as if it's a weight thing, then if you're at a weight, at a weight that you're aiming for, then you could stop where you are. But if you feel that you still haven't got the hair density that you're after, then you could steadily increase and watch for those symptoms. As long as you're not experiencing them, then you can increase by a quarter of a tablet, 0.625 milligram, every month, every 2 months, until you've got your desired result.
I see. Yeah, the only problem with me is that, and I know these medications take time to show any results, the recession on my hairline is still continuing despite being on both finasteride and oral minoxidil. Finasteride 1 mg being 1 month, and then oral minoxidil about the same time now, 2.5 twice daily. So I know that, I should be patient enough, but do you have any advice of how should I monitor results, or what are some telltale signs that it is working, at least, oral minoxidil?
That's a really good question, actually. Look, I think get some really good photographs of your hairline, with that can show your hairline, so you can watch that. Now, I don't think this is published, but minoxidil will not restore your hairline, and in my experience, minoxidil alone will not stop the ongoing recession of your hairline. Right, despite what some people think. In exceptional cases, I have seen minoxidil restore the hairline, but usually not. And from what I see, and I've in the vast majority of the men with male pattern hair loss that I see, you actually need a 5-alpha reductase inhibitor to stop your hairline from receding. Now, you said you were taking low doses of finasteride to begin with, and then you gradually increased to 1 milligram. Now, you may know that dutasteride is more potent than finasteride. If you feel your hairline is still receding, I would consider dutasteride in addition to minoxidil. Minoxidil, as good as it might be for certain things, obviously it's not the be all and end all. It will not, minoxidil alone will not completely stop the recession of your hairline. Especially if you've got a strong predisposition to male pattern hair loss based on potentially your family history and so on.
That makes perfect sense. Last follow-up, and I'll allow Joe to take other questions as well from the chat. With oral minoxidil, I've also heard a lot of people report that there's a shedding phase where your hair might get thin in other areas. And I have a little bit of thinning on my crown, so I'm not sure if that's recession or that's shed induced due to oral minoxidil or finasteride. Have you seen in your practice and experience that there is a shed associated with use of oral minoxidil?
We tend to counsel people So sorry, Joe, can I just check? So it seems Jeff is hearing me fine. Yes, is that correct? So we tend to counsel people that in the first few weeks of taking oral minoxidil, you might experience, and I think that can be the case with topical as well, this paradoxical telogen effluvium, whereby you will shed some telogen hairs that you will shed them before your hair grows. Now, it's not often that people complain of that, particularly men who have short hair. They probably might not be aware of it. Women will sometimes complain of it, but not even all women. But yes, we do counsel people that is possible. And it sort of makes sense because minoxidil sort of stimulates the anagen phase, the growth phase of the hair. And if you've got a telogen hair sitting there, for the new hair to grow, it'll push that hair out and you'll have a bit of a shedding phase.
Jeff?
I see. I think I'll just sort of have, very go on.
If I may add, Jeff, if you're experiencing this shedding, and I think I've heard Joe and Spencer mention that on the Bald Truth. Do not panic and do not think that that's a reason to stop, because actually that hair, that hair that is shed, there is another hair growing behind it. So carry on, if you see that.
Yeah, it's important to stay the course because while it can be scary as hell to see an increase in shedding after you start a medication, which is very counterintuitive. It is fairly normal. So you're right. That's what I've always said. That's what Spencer's always said. Always evaluate your comfort level, but in general, it means that good things are coming. At the very least, in the form of a stabilization for future hair loss. But the caveat there is there are some cases where it didn't work out so great, and it was better to just cease the medication. But that seems to be the exception, not the rule. It's usually an indicator that a new hair is coming in to replace the ones being shed out.
Yeah, no, that's what I've heard as well. And just to sort of add something there, it's when I say shedding, it's not that I'm seeing a lot of 200, 300 hairs in the sink or in the shower. But it's more like, I'm seeing areas on my scalp which have started, looking more thin than before, especially on the crown. And the only explanation so this could be two explanations. Either I'm receding that in that area, or it's like a momentary shed, which might recover in the future. That's where I'm sort of divided and not being able to assess correctly what's happening.
How long have you been taking the medication?
Oral minoxidil would be a month now. Yeah.
Okay. Yeah, it's way early then. And any other medication? Did you say you're on finasteride or dutasteride right now?
Not dutasteride. Finasteride 1 mg for a month and 0.5 mg every other day for about 5 months before that. So finasteride would be 6 months now, and oral minoxidil is just 1 month. Okay.
All right. Yeah. As far as the oral minoxidil, you've not been taking it long enough to see a result, but 6 months now that you've upped your dosage, it may be a dosage that'll work better for you. So you still got time to see some sort of improvement. Don't rush to judgment yet. Stay the course.
Got it. Hey, thanks, Joe, for taking my question.
Yeah, absolutely.
Have a great one.
Thanks for calling.
Thank you.
All right, it's a good call. Toll free 1-833-563-4247. The line is open. Had a few calls trying to come through, but had to knock those off because we didn't want to interrupt Jeff. The line is back open. 1-833-563-4247. I did hear him say something about taking 2.5 twice daily, orally. So is that something that you're seeing a lot, or are you prescribing it twice daily or just once daily? I thought once was enough.
No, we for men we often prescribe more. One of the studies actually published by the Spanish group of Sergio Vano used 5 milligrams, but we use in men, even in women, we use more than that, and we see that the hair growth with minoxidil is dose dependent, and with doses above 2.5, there's no doubt that you get better results than doses less than 2.5.
What's the typical dosage that you prescribe for men?
The average for men is 5.
Okay.
With some, obviously some are more, and obviously others are less.
Yeah. Okay. Fair enough. Dr. Bevin Bhoyrul is here to answer your questions about oral minoxidil for men and women, as well as other treatments that are out there. The phone line is open, toll free in North America. You can call 1-833-563-4247. And of course, any Skype or calling app worldwide, give us a call. He is here to answer your questions. Now, Dr. Bhoyrul, I want to reference the Sinclair study, or studies, or however it's referenced. Can you tell people that are watching or listening, give kind of a description or a summary of I think it was 2017 that the study for oral minoxidil and hair loss came out from Sinclair Clinic, or Dr. Sinclair. Can you elaborate on that?
So I can't remember the year, but yeah, he published a study in which he treated women with female pattern hair loss with a combination of a very low dose minoxidil, 0.25 milligram, and spironolactone, 25 milligrams. And the outcome that he looked at was the Sinclair grade that he's devised himself, which is a scale from 1 to 5. 1 being a woman with no hair loss, and 5 being a woman with the most severe form of hair loss. And
sorry, 1 second, Doc. We got a call coming in. We'll get back to that in a minute.
No problem.
Hey, you're on the main event. What's your name and where are you calling from?
Hey, Joe. This is Jim from Peoria.
Hello, Jim from Peoria. Didn't you call yesterday?
I did. Yeah, I did.
Right on. Good to hear from you again. You got a question for Dr. Bhoyrul?
Yeah. Hi, Dr. Bhoyrul. Nice to speak with you.
Hi.
Similar to the last caller, I've been on oral minoxidil and also dutasteride, both for about 6 months now. And similar to him, I do take the 2.5 twice a day, so I am taking the 5.0 milligram. And similar to his results, I'm not really seeing the results that I'm hoping for from either product. And I don't have any side effects, so it is nice to hear that you do sometimes prescribe more than the 5. I think you said that was kind of the standard. But before I up the dose, or I ask my derm to up the dose, I know that for oral minoxidil, you're supposed to have a specific enzyme, and I don't know if that is required for the oral. I know for the topical, you're supposed to have the sulfotransferase 1A1 enzyme, but do you still need that for the oral as well?
Yeah, good question, Jim. You do actually. So that's one of the reasons why oral minoxidil can work where topical doesn't. So you do need that sulfotransferase enzyme. So the sulfotransferase enzyme is found in the hair follicle, and it's also found in the liver. Now, a lot of people haven't actually got enough of the sulfotransferase enzyme in the hair, which is why topical minoxidil is ineffective in up to 60% of people, because they cannot. So minoxidil itself is called a prodrug. So minoxidil doesn't do anything to the hair. It has to be converted to this other compound called minoxidil sulfate, which is what causes hair growth. And that's done by the sulfotransferase enzyme. So either at the level of the hair follicle or in the liver. So if you do not have it in the hair, then you may have it. Well, then you probably do have it in the liver. Now, most people have it in the liver, so it's not usually a problem. And even if you have got low levels of it in the liver, that's where oral minoxidil kind of makes sense. Then you can increase the dose of minoxidil so that even if you have low levels of the enzyme, you can get around that by using bigger doses. I don't know if that makes sense. Now, do you mind if we just get a feel for what your hair is like, Jim? What is your hair like? Where are you on the Hamilton-Norwood scale? How bad is your hair loss?
So I'm probably closest to a 4A, and I've probably been between a 3 and a 4 for the last 15 years. So I did start the topical minoxidil and oral finasteride, 1 milligram, about 7 or 8 years ago, let's say. Worked really well, and it just started to feel like it was losing effectiveness. Of course, Joe reminded me yesterday that may not necessarily be the case, but it started to feel like it was losing effectiveness. So, but still about a 4A, but it is thinning more on top where it had been in the crown area where it had been pretty thick for a long time.
And how old are you?
50.
50 what is the hair loss like in your family? I mean, these are obviously things I'm sure you've looked at.
Yeah, it's pretty, like, I would say my brother, younger brother, is actually like a Norwood 6 already. My dad's probably the 6, 7, and then even a lot of the uncles and grandparents are probably all 5, 6 minimum.
Something's working.
I'm fighting a gene.
Yeah, and when you say that it's not working, what do you mean exactly? So one of the big things, and I think maybe we can touch on that later, Joe, is managing patients' expectations. When you say it's not working, what do you mean by that? Are you talking about your hairline, your crown? Which part of your scalp are you referring to?
More on the top. So the front, the hairline had receded way back in my 20s, and so I wasn't really expecting any new growth, but I was really just trying to maintain everything on top because it had been, like I said, pretty thick for a long time. But noticing, I've been shedding for a while, and I say shedding, I'm losing hair. I don't know if it's a true shed or not, but when I say a while, probably over a year, right? So it's been quite a while where it's maybe 10 hairs every day when I get out of the shower, which may not seem like a lot to a lot of people, but I guess the previous 6, 7 years, I couldn't find any hair, like, at all. It was just, everything was kind of on lockdown, which was a good thing, right? But now that's not the case.
And do you think you're losing ground in terms of the thickness of your hair?
Yes. Yeah, because I'm starting to be able to see a little bit of scalp on top where I couldn't. It was thicker on that crown area, but now in certain lighting situations, I can see through. So,
look, I mean, that's quite a tricky one, Jim. It's a bit unfortunate, and it is possible that, look, while those medications are good, and without them, as Joe said, probably you might have been in the same position as your brother or your dad. They do not, I find a tiny proportion of men keep losing their hair in spite of those things. If you have a very strong predisposition to hair loss, those things may not hold the hair loss completely, even though I would say that over 95% of men, will stop their hair loss with medical therapy. But you might be one of the unlucky few, in which case you could consider sort of other things that might stop the hair loss. I don't know if that's available, but in guys who are in a position like yourself, who are taking dutasteride and a relatively high dose of minoxidil and who are still receding, I will sometimes add something like dutasteride mesotherapy. If you haven't got access to that, then perhaps you could consider something like PRP. Now, that being said, obviously, the reason I was asking you about which part of your scalp you're referring to, and I think it's important to stress that, those treatments may not give you everything you're looking for, especially the guys, who are referring to their hairline. Oral minoxidil will not give you that back. So, it may be worthwhile considering alternative things. Yes, increasing minoxidil beyond 5 milligrams may kind of give you some more hair growth, but in my experience, once you go above 5 milligrams, yes, you might get some more increases in hair growth, but that tends to plateau. So I tend to advise people that yes, going beyond 5 milligrams, you might get some improvement. Generally, that improvement slows down.
Okay, that's good to know. As far as the enzyme itself, is there a way to really measure that, or not necessarily? To determine if you have that.
This is only experimental at the moment. There's a doctor who's based in California, I think, called Dr. Andy Goren, who has measured levels of sulfotransferase in hair follicles, but it's not something that your doctor or your dermatologist probably will be able to do. It's done experimentally. But the other thing is, even if you find that you have low levels of sulfotransferase in your hair, he's measured it in the hair. You can't do much about it except switching to something like oral minoxidil. But it's not something that's widely available, to my knowledge. I'm not sure about the States, but yeah, I think it's only done in labs. So to my knowledge, it's only this. It's only Dr. Andy Goren who's done it.
Okay.
I think Jim's going to be contacting Andy Goren's clinic and asking to sign up for the next study.
No, I don't know how reliable that would really be. I understand there's probably a way, but I don't know. If there's only one person doing it, I have a hard time believing it would be terribly reliable. But what about? I guess my last question for you then, Dr. Bhoyrul, is there any way, or is there a specific way to improve the gains from oral minoxidil? Like, I don't know, taking it certain times of the day, with food, without food, or are there any other medications that might interfere and limit the absorption, like other vitamins or supplements?
Unfortunately, not. Unfortunately, I don't think so. There's not much you can do to improve the results of oral minoxidil in terms of your lifestyle or whatever else you're doing.
Okay.
I don't think so anyway at this stage.
Yeah.
All right. Is that it, Jim?
Very good. All right. Yeah. Thank you guys for your time. Appreciate it.
All right, buddy. Thanks for calling.
Thank you. Thanks, Jim.
Bye-bye. 1-833-563-4247. You're watching The Main Event with special guest Dr. Bevin Bhoyrul from Melbourne, Australia, here to answer your questions regarding oral minoxidil and any other hair loss treatments that you've got questions about. One question that popped in my mind, Doc, is we know that with finasteride, there's no adverse interactions that we're aware of with other medications. I've never even considered that with minoxidil. Is there? And this was inspired by Jim's last question. Is there any negative interactions with other medications that you're aware of with minoxidil?
Not really. The main thing to be aware of is obviously the effect on blood pressure. So if you're talking about people who have a high blood pressure and who are taking other blood pressure medication, then you've got to make sure that taking minoxidil in combination with their other blood pressure medications is not dropping their blood pressure too much. But bearing in mind that the doses used for blood pressure are much higher, so 10 to 40 milligrams is what they use for blood pressure, sometimes even higher.
Right.
So, but that would be the main one.
Now, a question in the chat room, and I think it's a great question. One of the side effects listed with minoxidil is pericarditis. and there was a video that someone had put out where he's discussing a case of a woman that had only been taking, I think it was 0.25 milligram for about 3 weeks, and she was having issues with pericarditis. Have you experienced? Have you seen any of this with your patients, or any of your colleagues have talked about it at such a low dosage and for such a short amount of time?
No, we haven't. And the study you referenced earlier on of the safety of minoxidil in over 1,400 patients didn't show any side effects like that.
Yeah,
I think I know the study you're referring to, one from South Africa, where someone developed sort of fluid in their pericardium.
mm-hmm.
The very high doses, with the very high doses of minoxidil, the 10 to 40 milligrams, sometimes even up to 100 milligrams, that they use for blood pressure. Obviously, all these patients were sick. If they had high blood pressure, and some of them had kidney disease, had things like lupus, and so on. So a small proportion of these people had sort of pericardial effusion.
Mm-hmm.
And that kind of thing. But I'm not sure whether it was established whether that was caused by the minoxidil or by the kidney disease or what have you. But with the low dose oral minoxidil, I'm not sure that's been. We certainly haven't seen it. I think I'm aware of that study that you're referring to. One patient from South Africa with a low dose of minoxidil. But other than that, I haven't.
Yeah, I know nothing about it. It's just a question in the chat room, and my initial question would be, okay, age, medical history before she started using it, like all these general questions you want to answer, because outlying situations like that are usually attributable to external conditions other than the actual medication. So I hear about these kinds of reaction videos and informational videos from time to time from different people, and I don't watch them, or sometimes I'll see them, and I don't see a lot of information regarding the patient's medical history, and I think that's really important, especially when it comes to a medication such as minoxidil. And so Sergey in the chat room, he's the one that threw that out there. And then thank you, Sergey. That's a great question. And I think it's important to discuss, because when we are talking about minoxidil, it does scare people off as it is if they read the side effects and realize, it's blood pressure, it's, there's potential cardiac implications. And when they read about pericarditis and these other situations, it can kind of freak people out. It bothered me at first. I'm still wondering about it, not just because of that, just because I'm hesitant to add a secondary treatment to my own regimen. I like keeping things simple, and knowing myself, I don't know if I could commit to remembering to taking a second pill or tablet or quarter tablet or whatever I wind up taking, in addition to my already very rigorous regimen and very involved of taking one pill a day. So that's the way I look at it. All right, so, got a call. All right, good timing. Hey, you're on the main event with Dr. Bevin Bhoyrul. What's your name and where are you calling from?
Hey, Joe, it's Jack again from California. I hope I'm allowed to ask the second question here.
You are, Jack. You made it through, so sure thing, buddy. Ask away.
Thank you. So the purpose was because I think Dr. Bevin mentioned something, and this was my question on a previous call. I didn't get a very clear answer, so since Dr. mentioned, I was like, I should definitely ask this. Dr. Bevin, you mentioned dutasteride mesotherapy, and I've been looking into it myself, researching on the internet, and wanted to hear about your experience with the results that people have on this therapy, as well as, so my question is a little tangential. Considering dutasteride is such a strong drug, I almost feel that if someone is not getting results from that, is that even possible that someone doesn't get results from even such a strong treatment? I know it's a little tangential, but just wanted to gather your thoughts. Thank you.
Sorry,
good question.
Is it possible not to get results from dutasteride mesotherapy? Is that your question? Or was that?
And yes, and then what has been your experience like seeing results out of this particular treatment?
Okay. So the first thing is that it works, and what I will say is that the results are better with oral. So I'll often counsel patients. The group of people who end up having dutasteride mesotherapy are usually people who are reluctant to take it by mouth, because the sexual side effects with the mesotherapy are virtually non-existent. I certainly haven't come across them, and I know in the studies of dutasteride mesotherapy they haven't reported sexual side effects. However, obviously, like other procedures like PRP and so on, it is expensive, and I tend to counsel people that, look, taking the tablet is cheaper. So if you have no reservations about trying the tablet, then take the tablet, because the tablet is obviously A, cheaper, and B, more effective than mesotherapy. So the mesotherapy, we usually use it, one, in people who are reluctant to take dutasteride orally. Two, people who maybe have experienced side effects with dutasteride, and three, people who are already on sort of maximal medical therapy. So they might be on a high dose of oral minoxidil, they might be taking dutasteride, and their hair is still not what they like, especially the crown. Dutasteride mesotherapy tends to be better for the crown. So then we will add that. And I have a few patients like that who have sort of got close to where they want to be with maximal medical therapy, but not quite got there yet. So then we'll add dutasteride mesotherapy, and that gives them that extra 5 or 10% that they want. But long story short, dutasteride oral is better than dutasteride mesotherapy.
That makes sense. Thank you, doctor.
You're welcome.
All right. Thanks, Jack. Nope, he's gone. Okay. All right. So line is open. We got 1-833-563-4247. We got Dr. Bevin Bhoyrul, special guest for today, to answer your questions about hair loss medications and treatments, including oral minoxidil. The man has a very strong background in hair loss treatments and with oral minoxidil. He's been involved with several studies and papers, and he is a fountain of knowledge. I think the first time I even heard of you was Global Hair Loss Summit 2020, when you had submitted you're invited by was it was it Chris? No, that was weren't you in the first one or the second one? Because the first one was Dr. Cole.
The one where Chris was the
that was the second one. Yeah, that was Global Hair Loss Summit 2021, and I had the pleasure of editing your presentation, the video, and I thought, man, this guy knows what he's talking about. I like what he has to say. So I feel honored to be able to meet you in such a way, and finally, talking to you like we have behind the scenes. And I'd like to thank you again for being here, because I think that this kind of information patients don't get very often, and especially someone such as yourself with your background. So I'd like to thank you for that, for coming on. You sent me some photos. Did you want to talk about some of these results that you wanted to share with me?
Yeah, if you like. But I'd just like to say, it's a two-way street, Joe. I learn an awful lot from people like yourself and Spencer. I think I've said it before. Yes, there are certain things you might learn from books and from talking to colleagues and so on. But yeah, you guys bring a different perspective, as well as the clinical knowledge and the perspective of the patient.
Thank you.
But one thing, if we get an opportunity to talk about is, oral minoxidil, as good as it might be, is not a panacea. It's not a substitute for hair transplants in many cases. Often, the best results, as you know, are doing those things hand in hand.
Yeah.
So minoxidil, as good as it is, that's why I spend quite a while when I first see a patient finding out what their expectations are, managing their expectations, and sort of, when someone says they're not happy with their hair, I tend to clarify what that means. And
yeah.
I'm obviously, you're aware of the importance of that. Are they referring to their hairline? Are they referring to the crown? I mean, even the other day, I saw a guy who, it's not often that happens, who wasn't concerned at all with his hairline. What bothered him was the crown.
Yeah, I've seen that.
And in which case I said to him, well, look, you may not need a hair transplant at all. But there are those situations where I tell them right from the start, look, the medication will give you sort of X degree of improvement, but if your hairline is what you're looking for, or if there are certain things you're looking for, it will not give you that. So then long term, you may have to consider surgery.
Yeah, that's a great point, and you actually took the words out of my mouth. It's not the panacea that many people think it is. The great results that I think that we're seeing are outliers, outside of the norm from what the average patient will get as far as a result. And back to what I think it was it Jack, or maybe I think it was Jack had asked from California, are there cases of dutasteride where there are no results? I can say unequivocally, yes. There are patients that take legitimate name brand Proscar finasteride, non-generic, just getting that out of the way so that the baseline of consistency is established by the original. I've seen people with no results from that. I've seen people with no results from any treatment, including dutasteride, minoxidil, anything and everything you throw at it, it just bounces off and has zero aesthetic effect. And I throw in aesthetic because that's the whole reason why you're taking it. It doesn't mean that there's not some sort of effect underlying that you can't see, but what's the point? So to answer Jack's question, based on my experience, yes, I've seen plenty of patients that don't have a result, and that can be for a number of reasons. But the issue with minoxidil overall, I can see why people get excited by it, because there is a lot of talk about it. And that's why I wanted you to come on today. One of the reasons, not just because you're a fountain of knowledge on this subject, but because you can help to maybe put a little water on those flames where people do think it's so much better than it really is. I mean, it can be great for some people, but what you just said about managing expectations, that's what I like about you, is you are filtering their information through in order to dictate how you're going to respond to their question about what can you do for me with this medication, or what can this medication do for me. So well done on that. I enjoy hearing about that. That's why I look for with doctors to begin with is, are they really taking the time to listen to their patients so they can understand what the patient's asking? That's extremely important, and far too many doctors don't understand that very simple concept. So kudos to you, and congratulations on being such a fine doctor. I think that's important.
Thank you.
Yeah. So, yeah, lines are open, people. 1-833-563-4247. We've got Dr. Bevin Bhoyrul from the Sinclair Dermatology Clinic in Melbourne, Australia, here to answer your questions about hair loss treatments, oral minoxidil, what works, what doesn't. Give us a call. In the meantime, do you want to talk about some of these results, Doc?
Sure.
Yeah. So we got DS, before and after on the crown. Can you tell us a little bit about this one? Do you know who I'm talking about when I say DS?
Yeah. No,
Okay. Yeah.
Can you can't bring up the photo on the video, can you?
Absolutely right. There we go.
There we go. Yeah.
Yeah.
So just a quick point, Joe. The patients who get improvements, they're not really outliers. I wouldn't say they're outliers. The vast majority of people will get an improvement, but the degree of improvement varies. A person like this. Is this an outlier? Probably not. Because they don't have the worst crown balding. So I would say the majority of people get improvements. Certainly getting an improvement of your hairline, that would be rare. But otherwise, yeah. So this person, not a hair transplant, someone who's been on oral minoxidil in combination with I can't remember whether it was finasteride or dutasteride, well tolerated, and this was after about a year.
Okay, that's good. And I like the quality of photos too. There's a consistency with a before and after. So well done on that. Okay, and then we got AJ. Fade that over. Okay.
All right, this is an outlier. So this person was on a high dose of oral minoxidil, 7.5, so more than 5, as well as dutasteride, and I can't remember whether he's also had dutasteride mesotherapy. So this is what I mean. So this person obviously has had a significant improvement in his hair. However, it's not back to where it used to be, and
right.
And this is where managing expectations comes in. You know, so I say to them, look, if you're looking for a full head of hair with medical therapy, that's not going to happen, but it can give you a significant improvement. Now, as it happens, you know, this guy didn't want any more treatment. He didn't want a hair transplant or whatever else. He was happy with what he got. So you know, as long as the patient is happy, I guess ultimately that's what matters.
Now, did he start his secondary treatment along with the minoxidil at the same time, the dutasteride at the same time as minoxidil, or was it at a different time frame?
So he started minoxidil together with finasteride.
Okay.
And then you know, when things started to plateau, that's when we switched to dutasteride, and he got further improvements.
Now, are you one to recommend multiple treatments at once, or are you do you like to see one result from one treatment before you add another as a secondary support treatment?
Usually, so multiple, you would mean, for example, minoxidil plus finasteride?
Yeah. Throwing, I refer to it as throwing everything in the kitchen sink at a problem. And the reason why I ask that before you get into it is because I like to look at medications as a step-by-step process where you start with one or the other first, give that enough time to do what it's going to do, to where you can determine whether it's effective or not before you add a secondary treatment. Because if you a couple years down the road, you decide, oh, I don't think this one's working, and you stop taking it, you might be wrong and go through a serious effluvium and regret it. And I think that if you understand for sure what's working by taking it step by step, you're going to be in better control of your decisions, or understanding your decisions better, or how to make decisions better when it comes to treatment, if you want to continue or increase the dosages, things like that. It's just my personal preference. So what is your approach to that? Do you routinely recommend both at the same time, either minoxidil and or finasteride and or dutasteride, or do you take a step-by-step approach?
Good question. Look, most of the time, both. Mm-hmm. However, in a few cases, let's say if I see someone who's an Norwood 2 and the rest of his hair is thick, and the priority is the hairline, then I could consider only something like finasteride, right? Mm-hmm. Because generally I find, so if someone would want to take minoxidil alone, for instance, or let's say even use topical minoxidil alone, in my experience, it doesn't stop the progression of your male pattern hair loss, and especially if your hairline is important to you, using minoxidil alone, either topically or orally, is not going to stop your hairline from receding. So if your hairline matters, then that's not enough. Mm-hmm. But if you're a Norwood 2, you're happy with the overall density of your hair, because for me, minoxidil adds density overall. So if you're happy with the density of your hair, what matters to you is your hairline, then, and you just want to take one thing, then just take finasteride.
Fair enough.
But if you're someone who's a Norwood 4, Norwood 5, and you're not happy at all, then I generally start both, because otherwise it's just going to take you long. It's just going to take you much longer to get to where you want to be.
Okay, fair enough. So we're going to be looking at AC before and after Vertex. Switch this one over. Can you tell us about this case?
Yeah. So this is someone who came in originally seriously thinking about a hair transplant. And as you know, it's not a great idea to jump into a hair transplant without medical therapy. So he's now also on 7.5 milligrams of minoxidil. He's on dutasteride as well as dutasteride mesotherapy. And now, although his crown is not, is not completely filled, he doesn't want a hair transplant anymore. So he's happy with how he is, so he's having the dutasteride mesotherapy every 3 months and taking the tablets.
Yeah, we got to consider that to be a huge success if he's going to forego surgery because of the outcome of his medical therapy. I like that. Well done, sir. Well done. So this final one here, this is going to be interesting. This is certainly a fantastic turnaround. This would be KH before and after. Oop. So 1 second here. Hold on. Caller, I'm going to put you on hold. Hold on, please. Continue, doctor.
Okay, so I guess this might segue into what we might talk about next. So this is someone with alopecia areata actually.
Yeah.
So who was treated with a JAK inhibitor, so baricitinib,
okay.
Regrowth of their hair.
Yeah. Now, how old is this person? They look young.
Yeah, so it's an adolescent. I can't remember, probably 14 or 15.
Okay. All right. And how long had she been dealing with the areata?
Oh, that's a good question. I can't quite remember that.
Yeah. No worries. No,
that episode of hair loss would have been for a few months.
Yeah. Yeah. That's an amazing turnaround. That's fantastic. And what can you remind people what would be the side effects from something like this that they'd have to maybe consider if they have a similar situation?
Look, again, like with oral minoxidil, the side effects are usually uncommon. The side effects that they've talked about in studies, very uncommonly are things like acne, slightly greater susceptibility to infections like colds.
I remember that part. Yeah,
colds and flus and that sort of thing, and sometimes increases in your cholesterol. So patients who take this have to have their blood tests checked on a regular basis.
Right. Well, it's a fantastic turnaround. So well done to you and the patient. Looks fantastic. Let me go ahead and. Oh, looks like the caller hung up. Caller, you're welcome to call back. I put you on a hold. The number is 1-833-563-4247. They may have hung up because it looked like an international call. I don't blame you. Who wants to pay for being on hold? But line is open, 1-833-563-4247. Oh, here we go. Looks like it's the same caller. Hey, you're on the main event. What's your name and where are you calling from? Hello?
Hello, Joe. My name is Nisar. I spoke to you 1 month ago. It's the 23-year-old student from India.
Hello.
I think you might remember. Yeah.
I do remember you. How are you?
So great, man. Thanks a lot once again for the last talk. It really put my mind at ease, and I could focus on my studies instead of dwelling on this for a long time.
We helped another one. All right, good stuff.
I was calling. Yeah. So after we just a quick recap so that so many people. So just to remind you what exactly I'm dealing with. I'm currently 23 and I've been on minoxidil. At first, I started receding when I was 21, 2 years ago. So at 21, I used finasteride for 8 months at 3 mg per week. And I had no other side effects other than a little bit of brain fog while I was on finasteride. So by the advice of my doctor, I reduced my dosage. And for the last 9 months, I've been on 2 times per week, 2 mg finasteride per week. And that seems to have reduced the brain fog, and it is just maintaining my hair. Like I've not seen any regrowth, but the hair fall is also not as much. Also, I don't have any family history of hair loss. Both on maternal and paternal side, nobody was at all balding. And right now, I'm like a Norwood 1.5 to 2, between a Norwood 1 and 2. So last time we spoke, you suggested to just continue the 2 mg dose, as I'm okay with my current hair, and transplant is not really an option right now. So I went back to eugenics once again after we spoke, and they also said essentially the same thing. Just one thing they suggested, that since I'm on a very low dose of finasteride, and this brain fog, like even at 2 mg, I don't really get brain fog, but mentally I think, okay, this medicine might affect my mental capability. So they just suggested that maybe you should try oral minoxidil. They didn't say that you should quit finasteride, but they just said that oral minoxidil is also an option. And I asked them about the topical minoxidil, but they weren't really positive about the topical. They said that they basically didn't recommend topical minoxidil. So I wanted to know your thoughts. Like, should I just do the finasteride as not risk anything, or should I add oral?
Good question. Okay, doctor?
So you're taking finasteride 2 milligrams 3 times per week, is that correct?
2 milligrams a week.
Yeah, 2 milligrams. Yeah.
Once a week?
No, twice a week. Like, I cut the pills and I take it 3 times.
3 times. Okay, so a 2 milligram tablet cut into 3.
Yeah, like on one day I'll take the full 1 mg, and the next 2 times I'll take it half and half.
Okay.
Okay, so 2 milligrams total per week.
Yeah.
And what is your where are you on the Hamilton Norwood classification? Where how bad is your hair?
Right now I'm like a Norwood 1.5, like not really a Norwood 2, but not a Norwood 1 also, like between a Norwood 1 to 2.
Okay. And what are you unhappy about with your hair? What bothers you about your hair? Is it just your hairline, or the overall hair thickness?
Just the hairline.
Just the hairline. So look, if the hairline is that goes back to, I think, Joe and I were talking about earlier. If the hairline is the only thing that bothers you, then you're quite right. Then just sticking with a 5-alpha reductase inhibitor like finasteride might be enough. If you're not looking to, because minoxidil really is a hair growth stimulant, so we'll add density where you've lost it. So if the overall density of your hair on the vertex, on the mid scalp, and so on, you're happy with, then probably there is no point in adding minoxidil. Then you might just stick with finasteride for now. As you get older, things might change, of course. Then you may want to consider it.
And his secondary issue is, the reason why he's asking that question is, he said that while he's not having brain fog, he's afraid that even at his current dosage, 2 mg a week, that he's inhibiting his mental potential. I guess you could say. Is that a proper interpretation, Nassar?
Yeah, exactly.
Okay.
Yeah, you got it completely right.
Okay. Yeah, Doc, what do you think?
Okay, so if you have the choice, you would rather even not be on finasteride, correct?
Yeah, true.
Yeah. All right. Okay, look, I think if you stop finasteride and you go to minoxidil, and if the hairline is important to you, a couple of years from now, you might not be happy if your hairline has receded. The other option you might consider is topical finasteride. Side effects with that are sexual side effects certainly are virtually non-existent, and brain fog I haven't come across. Do you have topical finasteride in India?
Yes, we do. Actually, for 6 months, like at the midpoint of 2022, for 6 months, I had tried topical finasteride, but I literally only used it on the edges of my hairline. Like because the area was so small, I used even less than zero point 0.5 ml. So, but literally on the receded and already receding parts, I used it for 6 months, but it didn't really do much for me. So I thought maybe I was a non-responder to minoxidil. But one of the doctors that I had seen, they told me that it's rare for minoxidil to work on the temple and hairline, and that I should use it all over the scalp as a preventative measure. But since it didn't work on the hairline, I'm a bit scared to use it on the already thick and dense parts and risk, the shed or something.
Mm-hmm.
No, Nasser, sorry, we're talking about topical finasteride, not topical minoxidil.
Right.
Oh, okay, topical finasteride, yeah. No, I haven't tried topical finasteride. It comes in in India, there's a lot of minoxidil and finasteride mixed variant, like 5% minoxidil, and in that there's 0.1 topical finasteride also mixed. But just finasteride I haven't seen. But there's a foam of topical finasteride. Like it only contains finasteride. It's 0.1% finasteride. So topical.
So it is available.
In the study of topical finasteride, where they showed similar efficacy to oral finasteride, although I do think oral finasteride is better, they use 0.25%. So look, if the brain fog is a concern, and if you're thinking finasteride orally might be having a bearing on your mood and or sort of your mental ability, then I would consider using topical finasteride, but I would make sure it's 0.25%. It is available commercially in certain European countries, but in other places you might have to compound it. So I would look for finasteride 0.25% and apply it every day. And I wouldn't just sort of apply it to your temples. I would apply it to the whole top of your scalp, because if your hairline is receding, then the crown might not be far behind. So I would apply it to the whole top of your scalp once daily, and I'm pretty sure. Well, I'm hoping your brain fog or the sort of effects on your mood will disappear.
Yeah. Thank you. Hopefully it does.
But I would look for a 0.25% preparation.
Okay.
Does that answer your question?
One more question, Doc.
Yeah, go ahead.
Yeah, just one more. Let's say hypothetically, if in the future or near future, I use oral minoxidil. So is that do you have how dependent is oral minoxidil once you start? How dependent is your hair on that? Like once you start using it, like finasteride, you can kind of quit finasteride for a bit and you won't experience too much of a shed. But minoxidil, especially the people who use it topically, I've seen that even 1 month or something, if they go off it, then the shed is very brutal. So is the oral also very similar? Like once you stop using it, even for a little bit, your hair, it might go away.
Doc, let me jump in on this real quick. Nassar, how have you heard that finasteride, with stopping it for a short amount of time, you won't go into a shed?
From my personal experience, I have switched off finasteride for 2 weeks, 3 weeks,
okay,
some of the time, and I have never experienced any shed.
Okay.
Although one thing is to be noted that throughout this hair loss journey of 2 years, my hair fall was never too severe, never more than 100 or 50, something like that. Hair.
Okay, fair enough.
So,
I want to ask that question because that is not something that would be applied as a blanket description of what people go through when they stop taking finasteride, even for say 3 or 4 weeks, there are a lot of people that do go through a shed after not being on the medication for a month. I've seen it many times, and I just want to make sure that you're not under the false impressions of how these treatments work. Yeah. So different people will respond quicker than others, and conversely, they can respond quicker to cessation of use quicker than others as well. And I've seen it many times. So I just want to make sure that you weren't getting this from a resource that's telling you this, like you're reading it, or if you say it's your personal experience, that's different. So I just want to make sure, though, that it wasn't being told to you by someone that you really don't have anything to worry about, because a lot of people do. Right. So I just want to make that clear. So
can I just? I completely agree with Joe on this point. It's minoxidil is not a substitute for finasteride. Not at all. So if you didn't experience hair shedding at 2 or 3 weeks when you stopped, I suspect that had you stayed off it for longer, something like 2 months, you would have seen it.
Yeah.
Because the telogen phase of the hair is 2 to 3 months long, and I suspect had you stayed off it for longer, and certainly had you stayed off the finasteride for longer than that, you would have seen your hairline start to recede again. So obviously you're taking finasteride for a reason, but minoxidil is not a substitute for finasteride.
Yeah. Any other questions?
Mm-hmm. No, that's all. Thanks a lot for everything, Joe.
All right.
And thanks, Doc, also. Yeah, very valuable input. This whole show is very informative. Thank you.
How are your studies? Did you get through? Did you finish your studies?
Oh yeah, just studying. Like this is the only time in the last month that I've even thought about hair loss. I just checked. I woke up and I saw YouTube and you were live. So I was like, okay, let's talk once more if it's possible.
In your exams, did you do well in your exams?
Actually, it's like a little bit far away, like a few months out still. All
right.
So yeah.
But you being able to study though and not worry, and so that's what matters. Okay. All right. Well, good stuff, buddy. Keep us updated on your situation and call back anytime. Okay.
Okay, thank you, Joe.
All right, thanks for calling.
Thank you. Thanks, Nessa.
1-833-563-4247. Great call from India, Nasser, following up from his previous situation. I think he said he called about a month ago. It's a good call then, good call now, and I appreciate him calling back. 1-833-563-4247. Got another call. Right on. Hey, area code 414. What's your name and where are you calling from?
Hey, my name's Robert. I'm calling from Sacramento, California.
Robert, how you doing, buddy?
Good, man. Good. I've spoken to you a couple of times before on the Bold Truth.
Right on.
So, you guys are very helpful then. I have a question. So I'll be 63 in June, and I've been taking I've been taking oral finasteride. I take a 5 milligram tablet and split into 4 and take it during the week and take all 4 during the week. So I'm not quite taking 1 milligram a day. And then I've been doing the MINOXIDIL 2 times a day for about it'll be 2 years pretty soon.
What dosage?
So I'm taking I use a foam, so I use, like they say, the capful, whatever looking amount, and I apply it twice a day, once in the morning and once before I go to bed.
Okay.
And I've seen good results from that. Probably started off on Norwood 5. It's funny.
And now you're Norwood 9? Is that where this is going? It's not been useful at all?
No. I've seen probably my hair thicken up about 20%, I say, in that time period. I didn't do the finasteride at first. I'm on the finasteride 1 year, probably right around now.
Okay.
And I had heard about the oral minoxidil, or what is it, Lotrin? Is that Lotron? What is it?
Lonitin.
The oral Lonitin. That's it. Okay,
yeah.
Lonitin. Yeah, I've heard about it for years, but then I've heard all the fear about it also, with it affecting your heart and all that other stuff. I have low blood pressure all the time. So my blood pressure has been, I've seen it at like 90 over 60. So
you're saying that taking a nap is not a problem?
Yeah, no, it's not. No, it's not. It's not a problem for me. So, would it be a problem for me to take this medication? The oral minoxidil.
Fantastic question.
With that type of a situation.
Doc, what do you think?
Short answer, no. But obviously, it varies. Obviously, some people are more sensitive to minoxidil. We have a lot of patients who have low blood pressure who are able to tolerate it. So I would try it, obviously, starting with a lower dose to see how you tolerate it, probably a quarter of a 2.5 milligram tablet to begin with. And then if you feel fine with that, then you can increase it steadily. Now, just a couple of points. So the topical minoxidil, some of it is absorbed systemically, so into your bloodstream. So even that will have a small bearing on your blood pressure. But if you can tolerate it, fine. I wouldn't be too worried about trying a low dose of oral minoxidil. There's a few things that you can do to kind of mitigate the potential low blood pressure effect of minoxidil. So you can take it in the evening, and obviously make sure you keep up your fluid intake throughout the day, because that can help sort of maintain your blood pressure. But no, we have lots of patients, even some with lower blood pressures than you, that are using oral minoxidil. So you could certainly try it, starting with a low dose and increase slowly, and see how you feel. Obviously, watch out for symptoms like feeling lightheaded when you get up quickly and that sort of thing.
I see. I have another question in regard to minoxidil in general. I thought I had heard that one of the side effects would be circles under your eyes, and I've definitely got a light case of dark circles under my eyes. And my sister hadn't seen me for a year, and she made a comment to me today, "Oh, you got circles under your eyes. You never had that before." And I'm thinking, well, could it really be that? Could it be the minoxidil?
Leave it to family members to tell you the truth.
Of course. Yeah. Yeah, exactly. Exactly. So is that a side effect of minoxidil, the dark circles? I thought I heard that somewhere.
Look, I've actually had maybe a couple of people mention this to me. I'm not convinced it's a side effect of minoxidil. One of the potential side effects of minoxidil is edema, so it's like sort of a fluid accumulation, either in your legs or sometimes other parts of your body. If you've got that, maybe, if you've got maybe a bit of swelling of your face, maybe it can make that a bit more pronounced. But sort of the dark circles in the absence of any kind of swelling, I'm not convinced.
Okay. Well, it's funny you mentioned the edema in the legs. I have noticed in the last year or so that my feet have been feeling kind of on the fat side, like there's swelling going on down there. And I can't say that that was ever an issue before. So, again, who knows? I don't know. But is there any way to kind of, you hear what I'm saying? I hope I explained myself well enough.
Yeah, no, I know what you mean. Look, I think there's without sort of going too much into that, there's many things that can cause that as you get older. So many things aside of minoxidil. So I think you said you're 63. If you've got that, I would certainly sort of make an appointment with your doctor to investigate that, because there might be other reasons.
Okay. Well, someone in my case is, what could I see? Would it just be a helping of a maintaining of what I already had, or would it actually? I have diffuse thinning on my crown, and you can see my scalp through my hair. It's a little worse on the crown than it is in the front. The front, of course, the mid center of my scalp is the thickest with hair, and the front is a little diffused, and then the crown is diffused. So, what would I be able to hope for with, the oral? I've heard that it really is much more potent than the topical.
Good question.
Look, if you're able to tolerate higher doses, And if you consider maybe a stronger 5-alpha reductase like dutasteride, you would see improvements in the crown, for sure. Obviously, you're not going to get back your original hair density, but you will see an improvement on what you've got now.
Okay. All right. Fair enough. Thanks for the input, Doc. And Joe,
thank you.
You put on a great show. I really hope you get more subscribers than you have because you deserve it.
Well, thank you very much. And it's a great show because of callers like you, my friend. Thanks for calling in.
Sure. No problem.
All
Thanks,
right.
guys.
Take care. Line is open, 1-833-563-4247, toll-free North America. Give us a call. You can also call worldwide from the calling app of your choice. It's currently 4:42 Pacific time. I believe that means it's, 9:42 a.m. for you on Friday. Is that right? Okay.
That's right.
We're good for another 25 minutes?
Yeah, absolutely, 100%.
Okay. All right. Hey, you're on the main event. What's your name and where are you calling from?
It's Morty from Brooklyn.
It's Morty from Brooklyn. What's up, Morty?
Not much, guys. Sorry, just tuning in. So I don't want to repeat any questions, but I'm going to take a chance anyway. So first of all, I want to say thanks for joining, Doctor, and I appreciate your input. I'm a low-dose minoxidil user, although I don't really say that I'm a low-dose user because I have high blood pressure, not terribly high, but high enough. It's I think my diastolic pressure will hit 130 at times. So the minoxidil, the oral minoxidil can help, appears to help with that. I think it knocks maybe 4 or 5 points off of that. So I'm very glad of it. I'm taking slightly higher dose than what's considered low dose. I take 7.5 milligram. So I take 3 2.5 milligram tabs. I take 2 in the evening and 1 in the morning. And one of the questions that I had to do with the half-life of minoxidil and whether it makes sense to space them out in that way so that you're not taking all 7.5 milligrams at once. Is that wise, or would it be better to do it breakfast, lunch, and dinner, or does it matter?
I don't think it matters. We tend to give it as one dose, actually. So for our patients who take 7.5, we just give one dose. So minoxidil has a half-life of a few hours. But I don't think that's an issue taking it. So even if you took all the tablets at once, as long as you can tolerate that's fine.
Mm-hmm.
Okay.
I see.
Okay.
Yeah, that was kind of my question was that the half-life was short, whether it made sense to space. So that's what I've been doing. So
now, Morty, were you taking how long you been taking oral minoxidil for high blood pressure? Was it before your surgery with Dr. Cole?
No. I started taking oral minoxidil after the surgery.
Okay.
After the first surgery, one of the things that Dr. Cole had observed was in the donor, we had what was considered a high telogen ratio, which basically means I think it was like something pretty high. It was something like 30% of all the grafts being pulled were in telogen. This concerned Dr. Cole quite a bit because my donor was only fair. It wasn't great, and I had a lot of ground to cover. So we actually did during the first surgery, we did a test where a certain portion of my crown was covered with a small number. I think it was about, maybe 100 grafts of just telogen hairs to see whether they would take. And lucky for me, they did. And at the time after it was done, we decided to try oral minoxidil. And when I tried it, I got on very slowly. I started with half a 2.5 milligram tablet once a day, and when I tolerated it, then I went up to a full 2.5 milligram tablet. And tolerated that to 5, and then I went in to see my regular GP and talked about my high blood pressure, and he said he wanted to put me on a high blood pressure med, and I told him I was on the minoxidil, and I asked him how he felt about me just upping the dose of the minoxidil, and he said, well, if you're on minoxidil already, then you could do that. So that's kind of where we ended up.
And I think that leads into a great question, though, for Dr. Bhoyrul. Have you, because you're talking about minoxidil being better for adding density to areas that are thinned out, are you seeing personally in your practice, are you seeing an improvement in donor quality on patients that are taking oral minoxidil?
Good. That's a good question. Yes, and in fact, there's a patient who actually came to see me. I can't remember where he was from, but he was considering going to see Chris Bisanga for a hair transplant.
Mm-hmm.
And Chris Bisanga sent him to me for an assessment beforehand, for a consultation. And his donor density was poor. So just off the top of my head, I can't remember, but it was something like sort of, 50 in the supraauricular area, and then 60 in the mastoid, and then sort of, about 50 or 60 in the occipital area. And he was in his 20s. So he was poor, and he didn't look like a good candidate, and he was probably a Norwood 3 or 4. And so we decided. So I told Chris that, and then so I put him on medical therapy, and then I saw him back 6 months later, and his density was much better. He still hasn't gone for a transplant yet because it's still sort of touch and go with his donor characteristics, but the density has improved significantly.
Okay, that's good to know. That's good to know. I think it's important to bring that up because, people are talking. Well, I know I've talked about it, and I know there's some doctors that are talking about it. But the quality of donor can be improved through the use of finasteride because there is a DHT sensitivity to some patients in the donor area, and that's why the idea that donor hair is permanent has been blown out of the water, especially with the advent of these super huge FUE sessions where doctors are taking from every little nook and cranny they can on the scalp. So I think it's important for people to understand that. And if we got something like minoxidil in addition to finasteride that can potentially thicken and strengthen the donor, then that's good to know for the long term. Sorry to cut you off, Morty. I thought of that question. I wanted to throw it at the doc.
No, that's fine. I just wanted to.
I agree. Sorry, Morty, and just wanted your thoughts on that, Joe. And certainly, in there is this obviously idea of the safe zone, of the donor. But in patients who are destined to progress to a Norwood 7 or Norwood 8, there's extreme hair losses where you've just got a thin band of hair on the back and sides. What you would then traditionally consider as the safe zone is very, very small. So the areas above that strip and the area below, if you develop retrograde alopecia, so they're prone to loss.
Yeah.
Now, you would have thought that these areas are also DHT sensitive. So I think if you're destined to progress to a Norwood 7, then you have no choice. You have to take a DHT. A 5-alpha reductase because your potential safe zone then is very limited.
Yeah.
What are your thoughts on that?
Well, I completely agree with that because I've seen cases where even large strip cases where hair was actually taken from the traditional safe donor area, but come to find out 5-6 years later, the patient's donor area had actually started to thin, not continued to thin. It started to thin unexpectedly, and consequently, his result also started to thin out in the recipient area. And he was one of these patients that was very diligent about being ahead of the curve on hair loss treatments. He was very aggressive with dutasteride before most people even had heard about it. For the hair loss aspect, and in my view, there are more cases out there than people realize where donor hair has thinned out. When it comes to these cases of potential aggressive hair loss, I think about some of the cases that I'm actually dealing with now behind the scenes, where patients are tempted to get these massive sessions, and I encourage them to be cautious. I don't want to say conservative, but take it in steps, small steps of smaller procedures, not going for these huge sessions where it's, over 1 or 2, even 3 days, and have them realize that, this is the long game that they have to play. They can't just rush to get their hair back in a year, because it could backfire hard. And not to mention that, you combine that with the issue of how the result itself might not turn out due to any number of factors that can inhibit hair growth, damage of grafts, or just, the recipient's scalp physiologically can't take the trauma of the surgery, or, any number of X factors that we as professionals struggle to define as a reason for any sort of deficiency in growth. So overall, I think it's just another aspect of consideration when patients are thinking about hair restoration, is not just the recipient where it's going to grow, but also the donor where it's coming from. How long is that going to last? For most patients, it'll last as long as they want it to, but for some patients, it will start to miniaturize. You got senile alopecia that can kick in the 50s on some patients. And I think maybe minoxidil could help to stave that off for a bit. But yeah, you never know. Like it is a crapshoot.
Yeah, I mean, no, completely. But on the basis of that one patient who's considering a hair transplant, he's gone from being a non-starter to a borderline candidate at the moment. So we're still watching to see how things pan out. But yeah, so far, I mean, he's quite a sensible guy. So he understands, and he's quite happy to hang fire and to just call the whole thing off if it doesn't improve enough.
That's because of great education from doctors like you. Morty, what else you got for us? Sorry to take over the airwaves there for a bit, but what else you got for us?
It's fine. I mean, the point that I was making was that at my second surgery, we looked at telogen ratios coming out of the donor then, and telogen ratios were a lot more favorable. They went to like 12%, or about half of what they were during the first procedure.
Yeah,
and
that's great.
I have to feel that at least it's in part related to the introduction of the oral minoxidil, simply because oral minoxidil in general, and again, Dr. Bhoyrul, if you have a different opinion, let me know, but that it's supposed to keep hair in anagen, and therefore would reduce the number of catagen or telogen hairs that are present.
Doc, what do you think?
Correct, Morty. So minoxidil prolongs anagen and shortens telogen. So at any one time, the proportion of the hairs on your scalp that are in anagen would be higher when you're on oral minoxidil, which is why you see less shedding, because obviously hair shedding is associated with your hairs being in the telogen phase.
All right.
Yeah, that's kind of what I was thinking, and it also speaks to what Joe, what you're saying also. And then is, if you're somebody who's starting to explore the possibility of getting a hair transplant, the first thing that I would tell people is you've got to get on some sort of medical therapy, and you've got to be able to prove to yourself. As a matter of fact, recently, Dr. Cole had me speak to a prospective patient, and I asked them about their use of medical therapy.
Why don't you just go ahead and admit that you work for Dr. Cole? Why don't you just tell us that you're a consultant?
I don't collect money from Dr. Cole. He hasn't. But the point I was going to make was that he felt that he was inconsistent about taking the meds. Like he would say, "Oh, I take it every few days when I remember." And I'm like, no. I'm like, before you do anything, you've got to get your consistency down with your medication. You can't just take it when you feel like it.
Yeah.
You have to be consistent with this stuff, because if you're not, you're going to create a world of hurt for yourself if you're going to go under the knife, because you're going to continue to lose hair. And again, and Joe, you were saying this also, even if you are consistent with your meds, you can still end up losing this particular battle. And so you want to give yourself the best possible chance of success, which means you've got to be consistent with your meds.
Mm-hmm. Yep. Well said.
Yeah. All right. Thank you, Dr. Bhoyrul, and thank you, Joe.
Thanks for calling, Morty.
Thank you.
We had a couple of people trying to call in. The line is now open. We had an 818 from LA. We had a 925, which is, I think, also Sacramento or San Francisco, I think. Maybe, no, that's 949. Okay, here's 818 again. See who this is. Hey, you're on the main event. What's your name and where are you calling from?
Hey, Joe, this is Gypsy from Los Angeles.
Hello, Gypsy. How you doing, my friend?
Well, I made it in time. I was in a business meeting. I'm like, I got to get out of this. I got to talk to Dr. Bhoyrul.
Right on. All right. What you got for the doc?
Well, okay. So, I've been on the fence about like switching to oral minoxidil, obviously. I do believe now we've been talking about the whole finasteride thing and all this stuff. So, I'm on the subscription thing over here. And I did.
Sorry, when you say you're on subscription, what are you talking about? With one of these online companies where they keep sending you your refills automatically? Keeps. Okay. Yeah.
Yeah. So I did notice. I didn't check at the beginning, but I did notice that manufacturing is done in India and all this stuff. So I think I had pretty good reaction at the beginning. And then it went down, and as you know, I mentioned this before, Joe, that around November, December, I decided to stop the topical minoxidil just to see how the finasteride by itself was doing, and I did notice that there was a change, meaning that minoxidil was probably contributing to some sort of maintaining effect. Now, I've also discussed with you in the past that, I want to get into the oral minoxidil, whether it's the generic form or brand name. So now, the specific question that I have today is, and I mentioned this before, I am an avid smoker. And what that means, in no uncertain terms, is I smoke 1 pack a day.
Okay.
And I know I'm probably going to get a lot of judgment from that. It's actually pretty normal in my community. And I do also have what it seems to be, in my estimation, I obviously, like you said, I'm not a doctor, but a pretty normal to the low end blood pressure and pressure. I don't have a high blood pressure. I know minoxidil, especially on the oral, the original form is the vasodilator. But I don't have hypertension or anything like that. Now, being a smoker and being the fact that I am already on the lower spectrum of blood pressure, getting on oral minoxidil, is there any concerns or any blood test or anything that I need to specifically inquire with my physician before I get into this type of, treatment?
What do you think, Doc?
I don't think so. I don't think you should be worried, actually, because obviously smoking plus a high blood pressure is bad news for your heart. But minoxidil, if anything, may slightly reduce your blood pressure. So if anything, minoxidil might be a good thing. So I wouldn't be too worried about taking oral minoxidil. Obviously, as everyone should do, you should obviously keep an eye out for symptoms like lightheadedness and so on, and if necessary, obviously check your blood pressure periodically. But I wouldn't be too worried about taking it.
Okay.
We have lots of patients who are smokers, and it doesn't matter. So what you should look out for is your heart rate, your blood, signs of low blood pressure. But otherwise, smoking alone is not a contraindication, so it doesn't mean that because you smoke you can't take it.
That's fair.
Okay. So now my plan is to, Joe, following your recommended advice in anything, is to titrate. I'm a topical, and so my idea is to, if I start with the oral, so maybe alternate one day topical, one day oral, And then instead of doing the 2.5, which I know it's typically what's recommended, maybe do the 1.25 and then work my way up to 2.5 and see if I have any palpitations or water retention or anything like that. So, what's a general opinion about that?
Alternating between topical and oral. Look, you don't have to do that. You can just slowly go up with the oral dose. So I don't know what you're taking now, but if you go from a quarter to for a month to half, and then to a full tablet. This is not evidence based, but we think that using the topical minoxidil would be equivalent to taking about 0.5 milligrams of oral minoxidil. So if you're if you're taking a quarter of a tablet, that's almost as well. That's probably as good as, if not better, than using the topical minoxidil. So I would just slowly increase on the oral dose.
Okay. That makes sense.
All right.
All right. Well, look, I just wanted to get my questions in. I know there's probably other people who want to have more questions in. That's probably the extent of my increase today.
The metaphorical line is around the corner, my friend, but we're going to keep you on. If you got a question, it's no problem. But I got to ask you, when you say that smoking is popular in your community, you're talking about a hookah, aren't you? You sit around the hookah.
No. Okay. Joe, okay, Joe, you and I, we've been talking for a while, and we haven't crossed that line. So I will tell you what my community is. My name should give it away. So I am what in some political correct circles would say is Roma or Gypsy. So
literally. Okay, all right. I thought it was just I thought it was just a fun nickname that you picked out.
Oh no! I'm the real deal. I'm the real deal. I do the music. I do all the stuff.
Well, that's nothing wrong with that at all, my friend. Good hearing from you. We might have. I think we'll take one more phone call and we'll call it a night. Gypsy, good hearing from you. Drive safe and quit smoking. We'll talk to you later.
We'll talk later.
Bye-bye.
Thank you.
I had to get that in, I had to get it in. I care about my subscribers. 1-833-563-4247. I keep seeing area code 925 trying to give us a call. You're late on the opportunity, my friend. But now you can, like if you're listening to me now, you can call in. There's a slight delay. You're probably hearing it now. 1-833-563-4247. Line is open to speak with Dr. Bevin Bhoyrul from Sinclair Dermatology in Melbourne, Australia. Almost said Sydney. Melbourne, Australia. We're only going to be around for another few minutes. We got a late start, so we're past 5 p.m. Pacific time right now. We'll give it a few more minutes. Unless we don't get a call, then I will wind it down. But it's currently 5:05 Pacific time, 10:05 Australian time. What's the time zone called there? Mauritius, not Mauritius. What do you call the time zone there in Melbourne that you're in?
No idea actually. I think Melbourne or Sydney time.
Okay. Oh, here we go. I think this is the mystery caller. Hey, you're on the main event. What's your name? Where are you calling from?
Hi, this is Mark calling from California.
Mark, thank you for calling back again. I saw you calling through, and I had to disconnect you because I can't figure out this damn ringtone thing to get it to stop. I've actually talked to the people that made the app, and there doesn't seem to be a way to do that. But I will fix that soon if I have to, getting another app. But Mark, thanks for your diligence. What's your question for Dr. Bhoyrul?
Yeah, I'll get right to the point. Does minoxidil work on the mid-scalp?
That's pretty straightforward.
Yeah.
All right.
Yes.
There you go.
Terrific. And so would you say your average person who takes minoxidil gets a 10 or 20% improvement?
Variable. Depends on the dose. Depends on where they are. Look, if I get someone who's an 0 with 7, then look, it's not going to happen. There will be some improvement, but it depends, and it depends on the dose. But some of the Joe put up some pictures earlier on, but actually this guy was actually probably close to an Norwood 6, and he's gone from being an Norwood 6 to not even wanting a hair transplant anymore. So that was a massive improvement. So it ranges from anything from some people who just stabilize their hair loss to people like him.
Yeah. Does it help your golf swing?
Yeah. Yeah.
I think it helps with the it reduces the aerodynamic nature of your scalp, so it allows you to plant yourself more firmly, so you can get that backswing going. How's that for an answer?
Terrific. Thank you, sirs.
Thanks for calling, Mark.
Thanks.
All right, I think that is a great wrap up to the show. Dr. Bhoyrul, do you have anything you'd like to add? We didn't get into JAK inhibitors. We didn't get into anything
Cosmo
else out
RNA.
there. But yeah, Cosmo RNA. Yeah, go ahead and yeah. Actually, I'd like to hear your opinion on this. Have you followed it at all? Have you looked at what this is about?
Yeah, well, I've read the paper by I think it was a group from Korea on the Cosmo RNA, and yeah, look, it's topical. It blocks the androgen receptor, which makes sense, and they reported no side effects. So look, it looks good. I think in their study they had two different preparations. One which was a low dose, which was I think 0.5 milligram per mil, and then the high dose, which was 5 milligram per mil. Now, and what they looked at was the hair counts at 24 weeks. Now, with the low concentration, the increase in hair count at 24 weeks was, I think, 2 hairs per square centimeter. So at 24 weeks, what is that? 6 months?
6 months, yeah.
And then, and then in the high concentration, which was the 5 milligram per mil once a week, which is now what is being marketed as Cosmo RNA, I believe, the increase in hair count at 6 months was 7 hairs per square centimeter. I mean, it doesn't sound like a lot, but I suppose, if someone is looking to stabilize their hair loss or even looking for that slight increase, it might be something useful. But it seems like, while it might be helpful, it's not. People obviously should still manage their expectations.
Absolutely. And I think in best case scenario, if you were to get a 7 hairs per square centimeter increase in density in a patient that is diffused, where there is no clear patch of skin, exposed because of hair loss, but just a diffused hair loss, I think that would create an aesthetic improvement that would be I don't know. I mean, I think it would probably be something noticeable, but if you're looking for a miracle, I don't see that happening, especially for people that have advanced hair loss. In fact, I was looking at the what's it called, the pyrrolidamide. It's hard to say.
Yeah.
Pyrrolidamide. The two studies going on there, I find that actually more interesting after having looked at both, where the two studies, the one in North America that just concluded for phase 2, it was an average of, I think
22.
No, that was a Chinese the Chinese study simultaneously running with the American study. The American study was 10, I believe. And that I find that very interesting. Hair Loss Cure 2020, he's in the chat room. He's more up on this than I am. But I think it was 10 hair units per square centimeter in the U.S. based trial, and then in their Chinese based trial, it was 22. And then placebo group actually had something like 15. So it's I mean, it's kind of like it's all over the place, right? So I find that more interesting, only because of the inconsistencies and the question marks that it brings up. But I agree with you that people need to temper their expectations. I think it's fantastic that there's another treatment on the market, but you couldn't pay me to try it right now because of the route that they took in their approval process by bypassing traditional pharmaceutical approval processes where it's a cosmeceutical, which is not as stringent, and I don't know. What's your thought on that?
Yeah, look, I mean, I guess well, I'm not sure what the regulations are in Korea. There were no safety signals in their study, and the fact that it's a topical, would kind of sound reassuring. Certainly, taking an androgen receptor orally, you'd be a bit wary of, although it's already happening. Sort of trans women, for example. I think I mentioned that in a recent talk. Trans women take oral anti-androgens, things like bicalutamide and spironolactone, and we're actually sort of having a look at what happens to their hair. It'd be interesting to see what happens to the hair of trans women on oral anti-androgens.
Right.
But they do cause a lot of side effects.
I'm sure.
Undesirable side effects, loss of libido, development of breast tissue, and that sort of thing. And look, if you're in the camp of being sort of wary of side effects of even things like topical finasteride, then who knows what the level of absorption of topical cosmic RNA is.
Yeah.
Look, I mean, the study, I think, did they have 40 patients or thereabouts? So not many.
Yeah, it wasn't a big study.
It wasn't a lot of people. So there were no side effects, but yeah, it'd be interesting. But you certainly would not want a lot of it to be absorbed systemically.
Yeah, right. And while you're going through that, I thought of another question regarding verteporfin. Have you been following this? I don't even want to call it a development, but this idea of verteporfin being something that can help to regenerate follicles after extraction in the donor area. Have you seen this?
It rings a bell, but no, I can't remember what it was. It wasn't something that was mentioned by someone in our chat group, was it?
I don't recall if it's being mentioned in our chat group. And for people watching and listening, Dr. Bhoyrul and I are part of a larger WhatsApp chat group with about, I don't know, a couple hundred doctors, I think. I'm not sure what the number is now. But there's a doctor in Jordan, I forgot his name, that he's doing an in-clinic trial on patients where he's applying verteporfin to extraction sites and monitoring regrowth. And someone asked me about this the other day, and I questioned the outcome, because he was apparently, there's some photos where there's a very small hair coming through in an area that was supposed to be devoid of hair after an extraction, but you'll see that in FUE anyway without applying anything, due to partial transections and recovery of a damaged follicle, where you think you're pulling out a 3-hair follicle and then one grows back in its place. So it's hard for me to take any sort of regrowth application in the donor area seriously when we're seeing that by accident anyway in a pure surgical environment without any sort of topical application to induce or regenerate hair follicles. What's your feeling on that?
I agree. Yeah, I mean, if you've got a partial transection, that's a very good point. Yeah, you will get a hair come through.
Yeah,
it might be a difficult thing to measure.
Yeah, I look at that as exactly that. It's just difficult to measure. There was a question also in the chat room, and I think after that we'll wrap this up. Hair Loss Cure 2020 would like to know what your feelings are on prolactin.
Yeah, so there's a study going on at the moment of a prolactin antagonist.
Mm-hmm.
I think we're one of the sites that are actually sort of contributing patients to this study. There are some patients who have shown some positive results. I don't quite know. I don't know whether anyone knows the potential mechanism of how prolactin sort of improves hair growth. But let's watch the space. I think there might be some positive results. But again, it's about tempering expectations.
Right.
I'm not sure these patients will get spectacular results.
I'm not sure any of them will,
yeah,
but it is what it is. They keep trying. All right. Well, excellent. Everyone, I'd like to thank all of you for joining us today for this special edition of The Main Event with special guest Dr. Bevin Bhoyrul from Melbourne, Australia, in Sinclair Dermatology. Dr. Bhoyrul, thank you so much for joining us today. I'd like for you to stick around after we shut down on the show because so we can chat a little bit. But it's been a real pleasure having you on.
Thanks to you, Joe, and thanks to you, and thanks to all the callers.
Awesome. Excellent. So, guys, thanks for watching, and don't forget to like this episode, please. Put a lot of work into this. I got the sound working for both sides, callers and guests on the show. So that was a lot of work. Show your appreciation. Hit that like button. And, of course, if you're not subscribed to the channel, please do subscribe and ring the bell for all notifications. I'm going to continue having the best guests ever on the main event right here on YouTube's The Hair Transplant channel. Don't forget to follow me also on Instagram, Joe Tillman Official. I keep trying to confuse that with my Twitter, Real Joe Tillman. Yeah, Joe Tillman Official on Instagram. Thanks for watching. Take care. All right.